Look at this.
So today we celebrate that 90th anniversary of one of the most significant pieces of legislation ever signed into law, the Social Security Act of 1935, and we're going to make it stronger, bigger and better. We're doing a job.
This is also good news.
Social Security Administration just made a major announcement that is great news for millions of current and future Social Security SSI and SSDI recipients. Look at this. Social Security Administration adds 13 more conditions to the expedited benefit list. This is great news because it means millions of Americans who were not eligible to receive these benefits now are eligible, and a number of them are going to get their application expedited under this new change that Social Security Administration just made. This is not just a bureaucratic update. It is a real-life lifeline for people who are battling some of the most severe and devastating medical conditions imaginable. For years, many individuals and families have struggled through long waits, mountains of paperwork, and delayed responses while facing critical health crises. Having their conditions added to the Compassionate Allowances (CAL) list means they will no longer need to endure the same lengthy wait for approval. Instead, their cases can be flagged for fast tracking, meaning a quicker decision and earlier access to financial and medical support.
But this is not it. President Trump signed a proclamation marking the 90th anniversary of the establishment of Social Security, boasting changes in his recent tax law aimed at providing relief to seniors.
Look at this.
So today we celebrate that 90th anniversary of one of the most significant pieces of legislation ever signed into law, the Social Security Act of 1935, and we're going to make it stronger, bigger and better. We're doing a job.
This is also good news, but the details are a little blurry. I'm going to give you each and every detail because it is important to understand how these changes impact not just seniors today, but future generations who will also depend on Social Security. The Social Security system has been the backbone of retirement and disability income for Americans since it was signed into law by President Franklin D. Roosevelt in 1935. Over the decades, it has grown to cover retirement benefits, disability benefits, and supplemental security income, SSI, for the elderly and disabled with limited income. Now, 90 years later, the system faces enormous challenges with funding, staffing, and the ever-increasing demand from aging baby boomers and disabled workers. Against this backdrop, both the Trump statements and the Social Security Administration's updates draw attention because they directly affect how millions of households will manage their day-to-day survival. Millions of Social Security SSI and SSDI recipients who were struggling are now facing one of the most devastating situations in history. Social Security customer service is already bad, and now things are looking even worse. The agency has seen staffing shortages, outdated technology, and high demand collide into what many describe as a crisis.
Patty Murray explained it brilliantly. She said Trump's first few months in office have been nothing but chaos. His definition of fixing things is breaking them and then lying about it. Look no further than Social Security and the VA.
Thank you. Well, Trump's first few months in office have been nothing but chaos. His definition of fixing things is breaking them and then lying about it. Look no further than Social Security and the VA.
She heard from a constituent who called their local Social Security office for 3 straight days and could not get an answer. They drove to a field office where every seat was filled. By 8 in the morning, an hour before the office opened, people started lining up, and by 3:30 that afternoon, people were being turned away. The best they could do was sign up for a later appointment. Why? Because the office was staffed by just one person. That is what happens when thousands of Social Security workers are pushed out with no plan. This is not an isolated complaint. Across the country, seniors and disabled individuals are reporting the same pattern. Long waits on the phone, endless hold times, or being told to call back later. In many cases, people are forced to physically visit offices where they encounter lines stretching outside the building. Some people bring chairs, water, or even snacks because they know they will be there all day. For individuals with disabilities or serious medical issues, this wait is not just inconvenient, it is dangerous. Patty Murray said that the wait times at Social Security offices are devastating. Just imagine when you need to schedule an appointment. You call and wait for hours just to talk to a human. If you're lucky enough to get someone, you get an appointment a week later. Then you go to the office and there's no place to sit because it's filled with people. Why? Because there are only 1 or 2 people working there. By the end of the day, you have to reschedule because it's already closing time. That's the biggest issue millions of seniors are facing right now. According to Patty Murray, analysts, experts, and Democratic lawmakers, this administration's staff cuts are the reason for these delays and poor service. They point out that funding reductions and hiring freezes left the SSA unable to keep up with demand, especially after the pandemic caused a surge of disability claims. At the same time, inflation and rising costs of living mean that many older Americans are leaning on Social Security more heavily than before, making smooth access to benefits more critical than ever. But recently, Social Security Administration made an announcement that shocked everyone. And this is a great thing. They said this: Social Security Administration adds 13 more conditions to the expedited benefit list. This is good news for millions of current and future Social Security SSI and SSDI recipients because 13 new conditions were added. That means people who were not able to receive benefits now are eligible, and in many cases their application will be expedited. Here are the conditions: alkaline syndrome, bilateral anophthalmia, Carey-Feynman, Zeider syndrome, Harlequin ichthyosis, child. Hematopoietic stem cell transplantation, LMNA-related muscular dystrophy, progressive muscular atrophy, primary amyloidosis, AL type, Rasmussen's encephalitis, thymic carcinoma, tetrasomy 18p syndrome, WHO grade 3, meningiomas, ZTTK syndrome. These conditions range from rare genetic disorders to aggressive cancers and progressive neuromuscular diseases. Many of them affect children, and others are devastating adult-onset conditions. For example, LMNA-related muscular dystrophy can cause heart problems and progressive muscle weakness. Harlequin ichthyosis is a severe skin disorder in newborns that often requires urgent and lifelong medical attention. Thymic carcinoma is a rare but aggressive cancer of the thymus gland. Rasmussen's encephalitis is a progressive neurological condition that often leads to seizures and loss of motor skills. By adding these 13 conditions to the Compassionate Allowances list, more people with devastating diagnoses will quickly receive the support they need. Instead of waiting months or years to get approved, their claims can be processed in a matter of weeks, allowing them to focus on treatment and care rather than endless paperwork. Remember, if you are facing any of these conditions, you may now be eligible. And if they are already on the SSDI SSI list, your application will now be expedited, meaning you'll get your answer sooner. However, due to staffing cuts, delays are still possible. These are troubling times for seniors as well, because benefits are not keeping up with inflation. According to John Larson, around 5 million Social Security recipients receive below poverty level checks. That means their monthly benefit is less than what the federal government defines as poverty level income. Even in 2025, about 40 million recipients rely on Social Security checks, and in total there are now more than 74 million SSI and SSDI recipients. For those living on fixed incomes, rising prices for groceries, rent, prescription drugs, and utilities mean that their Social Security checks do not stretch as far as they once did. The annual cost of living adjustment, COLA, helps, but many advocates say it is not enough to keep pace with real-world inflation, especially in healthcare and housing. Lawmakers are working day and night to advocate for seniors and disabled Americans, pushing the administration to provide an increase so they can survive and thrive. Some proposals include boosting the minimum benefit so that no senior lives below the poverty line, adjusting COLA to more accurately reflect seniors' expenses, and expanding SSI eligibility so more disabled individuals can qualify. If you are struggling right now, remember there are state programs that you can apply for in addition to federal benefits. States often provide supplemental payments, Medicaid assistance, utility relief, and food support programs. These programs can help fill the gap while lawmakers in Washington debate larger reforms. Thank you so much for watching. Please take care and have a nice day.